Bismillahirrahmanirrahim. This is Dr. Ghufran Babar, endocrinologist and a pediatric physician in America, and you're watching my YouTube channel. I'm here today with the updates regarding COVID-19. And today's bigger news is the rapid COVID-19 testing in America. President Trump has recently said that about 150 million kits have been obtained from Abbott lab. And this rapid COVID-19 testing could be breakthrough in terms of testing for the illness. But the question is when to test for this illness once you're exposed to COVID-19 patient. The CDC has recommended that the test should be done when the person becomes symptomatic after exposure. Because remember, the incubation period could be up to 10 to 14 days. However, from what we have learned is 33 states out of 50 are not following this recommendation, meaning they are testing people as soon as they find out that they are exposed, and if they are negative, they think that they don't have the disease without realizing that they may still be in the incubation period of the illness and they do not have symptoms. So what happens is when the test becomes negative, because it takes a little while after being exposed to the COVID-19 antigen and the immune cells to make the antibody, it may take a little while. So those people, when they are tested negative within that incubation period, they think that they're fine and fail to self-isolate themselves, go back to work, go back to parties, co-workers, gatherings, and may spread the virus and may still remain asymptomatic. So, the recommendation is that you self-isolate and for 10 to 14 days. And if you develop symptoms, go ahead and get yourself tested for COVID-19 virus after being exposed. So that's the recommendation. The second good news is that possibly before the end of the year, there may be some sort of vaccine, which may be realistic or unrealistic expectation, but we all hope that this will be possible. And once the vaccine is there, it will be a great thing for the people since they will be developing some immunization against the illness to get rid of it. The rapid COVID-19 testing is a breakthrough testing because of the results are available in 15 minutes. So in urgent cares or ERs, with the winter coming up, flu season coming up, as well as in children, the RSV virus season coming up. So children who come with history of fever, cough, congestion, difficulty in breathing, if they can get these 3 tests done simultaneously or one by one, then you can find out the cause of the symptoms. If COVID-19 is negative, then it's good. And if RSV test is positive, it could be treated accordingly. Or if the flu test is positive, the treatment is available for that as well. So down the line in the winter months, this will be a game changer and will help the urgent care and the ER docs in decision making for any patient showing up with symptoms of fever, cough, congestion, respiratory distress, especially in children. Saying that, now we have 150, now we have up to several thousand deaths in America. The total death count is 187,215, with number of new cases is 32,709. And the deaths are rising by 1,000 deaths approximately every day. However, the overall weekly hospitalization rate has gone down. The deaths, will go up to 300,000 by this December if universal mask wearing is not available. There is COVID-19 fatigue in people. They're sick and tired of wearing the masks, mainly, while social distancing as well. They cannot do the social events as commonly. Same is with the hand washing. So I know it's the testing time for everyone, but hopefully as the time progresses, things will get better. The rate of hospitalization in African American, Native Indian, and Hispanics is about 4.5 to 4.7% higher than the white population. In Asians as well, it's low. So it's really not known. Why is it? Is it the weight in these communities which is higher in terms of BMI, or there's low vitamin D level, social distancing, hand washing, face mask wearing, going to gatherings, they're following the preventive measures or not. So all these things are the confounding factors. However, like I said, the hospitalizations are higher in the minority population. So vitamin D is a major factor. So make sure everyone takes recommended daily allowance of 600 international units as recommended by International Internal Medicine Society's recommendation, or 1000 international units could be a safer number every day. Other than that, global cases of COVID-19 are rising up to 25 million cases, and the rate of increase of cases is about 1 million every 4 days. So this is a big problem, that the disease is still spreading in all over the world. India is one of the countries where the disease is spreading rapidly. 64,617 deaths reported so far, 79,000 new cases in last 24 hours. And from Mumbai and Delhi, where there was a profoundly higher infection rate, it's kind of plateauing, and the disease is now spreading to rest of the India, and deaths are continuously rising. And India is now third in number when it comes to the number of deaths. However, in the cities of Mumbai and Delhi, the rate of acceleration of disease is not that high, and there is hypothesis that is there across immunity, because people who are immune to other coronaviruses may be showing signs of immunity to COVID-19 as well, which may be contributing to kind of herd immunity, but time is going to tell what will really happen down the line. As far as UK is concerned, the deaths today, total deaths are 41,500, new cases 1,715. There was rapid spread after isolation. The things have gone better, and NHSA, National Health Service in UK, is trying to trace the death cases and to do isolation of those cases, as was in Manchester area, Lancashire and West Yorkshire, and now the cases have been isolated. They had the kind of lockdown like situation, which was lifted in July, so which is a reassuring thing. As far as the rest of the world goes, Brazil or South America and Peru, they continue to have higher number of cases. Brazil has 121,000 deaths almost, with 15,346 new cases in last 24 hours. So top in the charts is USA in terms of the number of the deaths. We had almost 187,000. Second is Brazil with 121,000. Third is India with 64,617 deaths. So unfortunately, lack of facilities in Peru. The death rate is the highest in that area. Brazil as well, the disease is spreading. Unfortunately, the hospitals are not able to take care of the increased number of severely sick patients with respiratory distress. There is lack of remdesivir, steroids, medications, oxygen, ventilators, and the death rate is rising in these areas. Rest of the Latin America, the condition doesn't look good as well. In Europe, France and Spain may be seeing a second peak, and the coming winter months would be very vital, since the disease may spread more. In France, children less than or greater than 6 years are mandated to wear masks when they go to school. In US too, some schools are opening up, some are doing virtual. Usually the elementary schools, which are smaller in number, less changing of the classes in between classes, smaller groups are starting, while the middle and the high school are either partially open or they have virtual classes or half virtual, half in person. So those kind of situations are being tried to limit the spread of infection in these populations, while college students are obviously at a higher risk based on current scenarios because of the social gatherings which are there, especially in those schools which are kind of party schools. There is a higher chance of spread of infection. So the Spanish flu, when it happened in 1918 to 1920, the deaths were under 1 year and greater than 65, and then the middle peak was in the age of around 25, so kind of a W-shaped kind of a curve. The time is going to tell whether this disease causes increased mortality under age 1 year down the line. But so far with COVID-19, there's less mortality in those age groups, that is children and young adults, while greater mortality in pre-existing condition people like obesity, heart disease, diabetes, chronic lung infections, and then geriatric population. Going down into Canada, again, this is a big country but widely spread country, 38 million population, 9,000 approximate deaths. Same is with Australia, big country, smaller population. Self-isolation is being carried out so to limit the disease spread. New Zealand, again, there were new cases up to 137 cases which have been isolated, and they've been asked to self-isolate themselves to prevent the spread of infection. So, this COVID-19 rapid testing would be the breakthrough. Making sure the people who have symptoms being exposed, they are diagnosed and isolated, and then those people who are presenting in the ER with respiratory symptoms down the line in winter, infections like flu, RSV, and COVID-19 could be differentiated. Vaccine in the winter months, if it comes, that would be another breakthrough in terms of taking care of the patients with COVID-19. Cross immunity in those populations where herd immunity is spreading. And remember, so herd immunity is when 60 to 70% of population is immunized or have developed immunity. Rest of the 30 to 40% population is prevented from acquiring the disease. So those few scenarios could present later in the winter, and we hope that the disease the rate of spread decreases, there's no second peak during the winter months, and people get prevented from this disease by vaccination, and immunization happens, and the downward trend of the pandemic happens. May Allah help us all and protect our families and friends. Please like this video, share it with your other friends and family members, and subscribe to my channel. And this is Dr. Ufran Babar. May Allah bless us all. Ameen. Sallallahu alayhi wa alihi wa sahbihi wa sallam. Assalamu alaikum.